Welcome back to Bipolar Talks, where we explore the lived realities of bipolar disorder and everything in between. Whether you're tuning in for personal insight to support a loved one or simply to deepen your understanding, thank you for listening mindfully. Before we dive into today's episode, go ahead and take a moment to like, comment, subscribe, and share this video with someone who might benefit from it. Every share helps us grow a community where mental health is understood, respected, and seen without stigma. Today's episode is called The Diagnostic Journey, Getting the Right Label. Because in the world of mental health, the label you're given isn't just a word. It can shape your treatment, identity, relationships, even your sense of hope. So let's walk through this complicated, emotional journey together. When it comes to mental health, one of the most significant moments in someone's life can be hearing a clinician say, "You have bipolar disorder," or "This might be depression," or "It could be borderline personality disorder." It's more than a clinical label. It's a turning point. Getting a diagnosis can bring clarity. It can validate years of confusing symptoms, miscommunications, and pain. It can mean that you're finally seen. But here's the thing. What if the diagnosis is wrong? Or what if it's incomplete? Or if it shifts later down the road? It happens more than we like to admit. Ever been told you have depression, only to discover years later it's actually bipolar 2? Or been treated for anxiety, when mania was hiding beneath the surface? If that's your story, you're not alone. And if you're still searching for answers, keep listening. What was your first mental health label? Did it feel like a fit, or something else entirely? Unlike physical conditions that can be tested with blood work or scans, mental health diagnosis is largely subjective. It relies on patterns of behavior, self-reported experiences, and observation over time. That's part of what makes getting the right label so difficult. Here are just a few reasons misdiagnosis happens. Symptoms overlap. Depression, ADHD, PTSD, bipolar anxiety, BPD. They can all involve irritability, sleeplessness, impulsive behavior, or emotional dysregulation. People present differently. One person's mania might look like creative brilliance. Another's might look like aggression. Stigma influences reporting. Some people minimize symptoms. Others exaggerate due to desperation for help. Time reveals patterns. Bipolar disorder often takes years to correctly diagnose because the first mood episode might be depression, and hypomania or mania may not appear until much later. Healthcare systems are rushed. With 15-minute psychiatric appointments and long waitlists, how can someone really tell their whole story? Getting the right diagnosis isn't just about checking symptoms off a list. It's about understanding the full human experience behind those symptoms. And that takes time, trust, and careful listening. Ever felt like you weren't truly heard during an intake session? How did that shape your experience? Let's get personal. Case Study 1. Sophia, 27. Diagnosed with major depressive disorder at 19. Prescribed SSRIs. For a while she felt okay. But every so often she'd crash. Or she'd feel too good. Too energetic. Too impulsive. At 25, after a week-long sleepless spree of online shopping, grand ideas, and a public breakdown, she ended up in the ER. That's when someone finally asked, "Have you ever felt like you were on top of the world, beyond normal happiness?" Bipolar 2 was the correct diagnosis. Years of misdiagnosis led to ineffective treatment and a deep distrust of doctors. Case Study 2. Jordan, 33. Originally told they had borderline personality disorder after one intense breakup and a period of emotional dysregulation. But no one asked about childhood trauma, or mood episodes that lasted weeks, or dissociation. It turns out they had complex PTSD with mood instability, not BPD. A mislabel affected how friends, therapists, and even employers saw them. Misdiagnosis can feel like emotional gaslighting. You know your mind. You know what you've lived through. But the system keeps saying, "That's not what this is." Have you ever been labeled with something that didn't sit right in your soul? Let's be honest. Getting the right diagnosis isn't a straight road. It's more like a winding path, full of detours, closed doors, and the occasional breakthrough. And while it can be frustrating, it's also deeply human. Here's what the real diagnostic journey often looks like. 1. Symptoms emerge. Something feels off. You're tired all the time, or your energy is chaotic. You notice mood swings, concentration issues, anxiety. 2. Seeking help. You talk to your doctor, maybe a therapist. You get your first label: depression, anxiety, ADHD. 3. Initial treatment. Maybe meds help a little, but not fully. Maybe they make things worse. You start to wonder, is this really what I have? 4. New symptoms arise. Perhaps a manic or hypomanic episode emerges. Or trauma memories surface. Now things look different. 5. Reevaluation. A psychiatrist or psychologist takes a deeper look. Maybe a new label. Or they say, let's watch and see. 6. Second, third, or fourth opinions. You advocate for yourself. You try new providers. You read. You journal. You ask hard questions. 7. An accurate, compassionate diagnosis. You finally meet someone who listens, who sees you fully, and who offers a diagnosis that makes sense. Not just on paper, but in your body, your story, your truth. Sound familiar? Or are you still somewhere in the middle of that list? Bipolar disorder, especially bipolar 2, is one of the most frequently misdiagnosed mental health conditions. Here's why. People seek help during depression, not mania. Most folks don't walk into a clinic saying, "Hey, I haven't slept in 5 days and feel amazing." They show up when they crash. Hypomania is subtle. It might just look like doing well, being productive, feeling confident. Who would complain about that? Mania can be confused with psychosis, schizophrenia, or even substance use, especially during a full-blown manic episode. Stigma makes people downplay elevated moods. We live in a culture that glorifies energy, hustle, and charisma. Women and people of color are underdiagnosed. Bias in healthcare plays a role. For example, Black individuals may be more quickly labeled with schizophrenia rather than bipolar. If this hits close to home, it's okay. It's not your fault. And you're not broken. Diagnosis is a journey, not a failure. Have you ever felt your high-energy moments were misunderstood or brushed off? One of the most powerful things you can do on the diagnostic journey is advocate for yourself. Here's how. Track your moods. Apps like Mood Notes or Dailyo can help. So can old-fashioned journaling. Bring data to appointments. Show patterns. Describe events. Use specific language. Ask questions. What else could this be? What symptoms are we not talking about? Learn the language. Understand the DSM terms, not to self-diagnose, but to communicate more clearly. Trust your gut. If something feels off about your treatment or diagnosis, say something. Get another opinion. You are the expert of your lived experience. And remember, advocacy isn't just about fighting back. It's about staying connected to your truth, even when the system feels confusing. Have you ever had to push back to get the care you deserved? Here's a radical truth. You can heal even before you're perfectly labeled. Yes, diagnosis matters. It informs medication, therapy style, and treatment planning. But you are not your diagnosis. You are not the label on a chart. You are a whole person. Some people live their entire lives with unspecified diagnoses, but they still learn how to care for their minds. Others find healing in community, creativity, lifestyle changes, and peer support. And many find that once they receive a label that feels true, they finally begin to build trust again with themselves and the system. So wherever you are on your journey, early stages, mid-search, or post-diagnosis, know this. You are not alone, and you deserve answers that make sense. Thank you so much for listening to Bipolar Talks today. We hope this episode helped you feel seen, validated, or even just a little more hopeful. If this episode spoke to you, go ahead and hit that like button, leave a comment about your own diagnostic journey, subscribe to our channel, and share this video with someone who might be walking a similar path. Let's keep building a world where mental health is understood, without judgment. And remember, the content shared in this podcast is for informational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you or someone you know is experiencing depression or any other mental health issues, please consult a licensed mental health professional. Always seek the advice of your physician or qualified mental health provider with any questions you may have regarding your mental health. Take care of your mind. Be kind to yourself. And we'll see you next time on Bipolar Talks.